This patient was referred to me for endodontic retreatment of tooth number 19. According to the patient, the root canal was done over 10 years ago. Recently, tooth started to bother her, especially when she would try to chew on it. She would try to chew on the tooth. So she went and saw her dentist. Her dentist gave her a prescription for antibiotics and pain medication a few days ago. So she has been on antibiotics and pain medication with no help. And then she was referred to me. So I just saw her. So I want to go over this case with you. Okay, so patient was referred to me specifically for tooth number 19. All right, so take a look at the tooth. There's a PFM crown here. Okay, prefab metal post, previous root canal. All right, so look how short the mesial canal there is filled. Do you see any periapical lucencies here? No. Again, this root canal was done over 10 years ago. Look at the distal root here. Look how short distal root was filled. Prefab metal post here. Do you see any periapical lucency here? No. This is not a periapical lucency. This is just part of normal bone anatomy. I'll show you a different angulation. Look at the furcation though. There is some furcation bone loss right there. All right. So immediately when I looked at this tooth on my monitor at the office as the girls were taking the x-rays, I thought patient is here for number 19, right there, VRF. Well, at least possibility of VRF. Not VRF 100%, but perhaps maybe that's a possibility, so I need to rule it out. All right. So went in. Patients, as I said, tooth hurts, specifically when I chew on it, bite down on it. Root canal was done over 10 years ago. And I've been on antibiotics and pain medication. Tooth still hurts, bothers me. So looked at the tooth clinically. No swelling, no sinus tract, fistula, erythema, what have you. None. Percussion slightly tender, palpation within normal limits. Probings 1 to 2 millimeters. Biting, chewing on the tooth, slightly tender. Slightly tender. The lesson starts from this point now. Always take multiple angulation PAs and never listen to another dentist and their opinion about what's going on. Do your own tests, do your own examination evaluation, be thorough, take your time, and as I said, never trust another clinician's diagnosis. Okay, so now let's look at another angulation here. Again, you can see no periapical lucencies associated with tooth number 19. There is some furcation bone loss, but take a look at tooth number 18. Tooth number 18. Old amalgam restoration. Percussion, very tender. Palpation within normal limits. Biting, chewing on the tooth, plus. That means that the tooth was very tender to biting down on it, to chewing on it. It had a Miller class 3 mobility. Miller class 3 mobility. Probings 8 to 9 millimeters in the lingual. Look at the furcation bone loss here. Look how much bone has been destroyed. What do we do next? Vitality, cold test. This tooth responded within normal limits to cold. So, right then and there, problem is not endo. So if I did endo on this tooth, I would have done endo unnecessarily. For no reason, I would have done a root canal for no reason. So my thoroughness showed that the problem is not root canal related. Problem is not tooth number 19. Problem is tooth number 18. Problem is not endo-related. Problem is perio-related. By the way, I looked at the tooth under a surgical operating microscope to see if I can see any cracks. No cracks. No cracks. So this is a perio abscess, perio problem. If I did a root canal on this tooth, as an endodontist, if I see every tooth needing a root canal, then I'm like the man who holds a hammer and all he sees is nails. You don't want to be that guy. You don't want to be that clinician. So I look at everything, keep an open mind. I'm thorough with my examination evaluation. So I told the patient, have your dentist refer you to a periodontist.